Effective knowledge retention ensures that learning is retained and can be applied in practical situations, leading to improved performance and productivity. Good day! We are the Group 1B of BSN 3E, and we would like to present our research paper entitled Factors Influencing Knowledge Retention in Online Clinical Exposure. I am Earine Mae Blanco, and together with me are my groupmates, Carruz, Thea Burgos, Mea Ashley Claver, and Miss Novelyn Curiana.
The onset of the COVID-19 pandemic resulted in the shift of clinical exposures to the online platform. In addition, the pandemic allowed a quick transition to online learning, ensuring support for the students to study at home and acquire practical skills. Therefore, the study aimed to determine the factors influencing knowledge retention in online clinical exposure among nursing students. Specifically, the study sought to answer the following questions. First, what is the demographic profile of level 3 and 4 nursing students in terms of sex, year levels, physical space, and general weighted average? Second, what are the factors influencing knowledge retention in online clinical exposure among nursing students in terms of teaching style, teaching mode, teaching resources, and learning styles? And lastly, is there a significant relationship between the factors influencing knowledge retention during online clinical exposure among nursing students in terms of the following variables: sex, year level, physical space, and general weighted average?
For the research design, quantitative descriptive design was utilized in the study. This describes the data acquired in a narrative format, which allows the researchers to interpret and expound the acquired data. For the instrument, a researcher-made questionnaire was utilized. It consisted of two parts, namely the participant's profile and the second part containing questions regarding the factors influencing knowledge retention of nursing students in an online clinical exposure. For the sampling of the study's target population was the level 3 and 4 nursing students from the University of St. LaSalle. Probability sampling was utilized, specifically simple random sampling. It was used to determine the participants who were able to participate in the study. A total of 225 participants were chosen and participated in the study.
For the results and discussion in line with the first objective, majority of the participants belong to the female category of 74.7%. For the year level, majority of the participants are third year of 51.6%. For the physical space, majority of the participants have rooms away from noise of 66.7%. And for the general weighted average, majority of the participants belong to the 1.60 to 2 general weighted average. For the factors influencing knowledge retention and online clinical exposure in line with our second objective, teaching style, teaching resources, and learning styles. According to the participants, these factors influences their knowledge retention. For the teaching mode, participants neither agree or disagree that this factor influences their knowledge retention.
There is no significant relationship between the profile variables of sex, year level, physical space, and general weighted average, and the factors influencing knowledge retention, teaching styles, teaching resources, learning styles, and teaching mode as proven by the p-values of no more than 0.9.
The study determined that teaching resources are vital when it comes to knowledge retention. The participants make use of and adapt with the ever-evolving technology and the use of internet to better equip themselves. Teaching styles and learning styles are also one of the most influential factors of knowledge retention in the online clinical exposure. The participants agree that interactive learning is a huge factor in knowledge retention. On the other hand, the participants neither agree or disagree that teaching mode is a factor.
In view of the findings of the study, the following recommendations are proposed. For nursing school administrators, they are recommended to plan to accommodate the diverse needs of all nursing students in online clinical exposure to improve their knowledge retention and provide an interactive online learning environment that promotes active learning, collaboration, and engagement. For clinical instructors, the clinical instructors should find their most effective teaching style, teaching mode, and teaching resources that can help the students retain the knowledge they gain during live sessions, and to innovate and customize how they can deliver their lessons during online clinical exposure. As for nursing students, the researchers recommended they should practice active learning strategies that promote knowledge retention, such as taking notes, asking questions, and participating in discussions. For parents, encourage their children to stay organized and actively engage with the material they are studying to improve their children's knowledge retention. Lastly, for future researchers, future research may be able to help in improving the online clinical exposure by discovering the weaknesses in the curriculum and by assisting in creating a better program that makes learning more interactive and effective for both the clinical instructors and the students.
Once again, we are the Group 1B from BIS and 3. Thank you for listening.